The South African Medical Association chairperson, Dr. Mvuyisi Mzukwa, joins us now for a reaction. Dr. Mzukwa, good evening and thank you very much for coming on this evening. As the Medical Association, what do you say when you hear a verdict that says the political head and the head of department created the circumstances in which deaths were inevitable?
Good evening to you, Thabo, and your viewers, and thanks for inviting me. Thabo, we welcome the judgment, and we've been waiting for this for quite a long time. But we are happy that families have been considered, though we feel that the law is taking long to address or to be responsive to what is the family, the pain, with those families. But we also feel that now politicians are going to learn that there is what is called accountability. When they take those at times foolish decisions that lead to a death of patients, they are not now going to be held accountable, because we know that also corruption is at the center of what happened. And we know that also we've learned a good lesson that you cannot ignore the voice of the medical profession when it comes to these issues, because you'll recall that our voice was out there, condemning this decision. But also it was not for the first time. It happened during the AIDS denialism, when the medical profession again was raising their voices to say this is against science, but people continued with arrogance that we have seen even in this case of Life Esidimeni.
Do you think, there is a learning that could have taken place there, particularly if you look at the recovery plan that has been in place since 2019 to 2024 at Life Esidimeni? Is there an improved corporate and clinical governance, especially at mental health institutions? Well,
there could be some improvements, in terms of the infrastructure and stuff like that. But when it comes to staffing, we are not anywhere closer to that. But also leadership and governance is a huge problem in the South African health system. It has been highlighted recently by the Academy of Science of South Africa, ASF, where actually they put it out there that the problem here is ethical governance and leadership. So no matter what you do in this country, if you do not address those issues, you are not taking this healthcare system anyway. But also we know that there's so much of political interference that we see in almost all the sectors in government. Because I must be honest with you, we are dealing with a democratic government that don't listen, that is very arrogant, that actually is a shame to this country to be dealing with a government that is ignorant in terms of people dying in the healthcare institutions. Not only about Life Esidimeni, it's happening all over in South Africa, including the Eastern Cape, where actually now many hospitals don't have equipment, don't have and even needles to attend to patients. So it is a disgrace of this government, that is not able to take care of the poor, no matter how they purport to be taking care of the poor. They have nothing. They don't care about the poor. They have nothing to offer to the poor. We have seen already, even the vulnerable.
So you're saying, as we wrap up, from your observation where we are sitting now, one of the recommendations, of course, would have been strengthen the human resource capacity. So get appropriate health specialists. Not only that, get really strong mental health teams, for example, are being deployed. You're saying if we were to look at that human resource component, it is still lacking even today.
It is still lacking even today because there's this austerity measures. Even that time, the problem with this government, it is a government that talks about saving money, not about saving lives. Even, recently we've been told about austerity measures. They can't hire staff, even if there are dire shortages. But the audacity to balloon the cabinet, because it's not about the people of South Africa. It's about themselves and the families. So you can't be telling us about austerity measures on one side, but you are ballooning a cabinet on the other side, where you should be saving lives. You are not saving lives. There are unemployed professionals out there. Instead of serving this country, they are going elsewhere. So this is why I'm saying this government does not care about the poor.
Dr. Mvuyisi Mzukwa, appreciate your time reacting there from the South African Medical Association. He is the chairperson.